Los Angeles County surpassed another grim milestone on Tuesday as more than 11,000 residents have now died from COVID-19 since the pandemic arrived, according to the County Department of Public Health. In less than a week, more than 1,000 people passed away from coronavirus as healthcare workers and hospitals grapple with an unrelenting surge of coronavirus patients. On Tuesday, the department reported 224 new deaths and 512 new cases of COVID-19. So far, the department has identified 611 positive cases across the county and 11,071 deaths. According to numbers released by the state Tuesday morning, LA County had 8,023 COVID patients in hospitals, including 642 in intensive care units. The county's 70 911 receiving hospitals with emergency rooms have a total licensed capacity of about 500 ICU beds, although in recent weeks they have implemented surge plans and staffed a daily average of about 3,000 ICU beds. The county's daily update did not include the latest numbers from the cities of Long Beach and Pasadena, which run their own health departments. Pasadena reported 253 new cases Tuesday, for a total of 7,449. Its death toll of 168 did not increase. Long Beach reported 528 cases, for a total of 35,664. The city also reported 18 fatalities, raising its death toll to 420, but the jump reflected a backlog from last week because of delayed record-keeping from the state. To the families and friends experiencing the sorrow of losing a loved one due to COVID-19, we send wishes for healing and peace, said Director of Public Health Barbara Ferrer in a statement. LA County reached the terrible milestone of more than 11,000 deaths due to COVID-19. As a community, we must commit to stopping the spread of COVID-19 in its tracks so that we can save as many lives as possible. Dr. Christina Gali, the County Health Services Director, told the Board of Supervisors on Tuesday that in addition to the continued stream of new patients, hospitals are coping with various other problems, including well-documented issues with oxygen supplies and delivery systems. Hospitals are also reporting continued backlogs of ambulances in emergency bays, some waiting hours to offload patients due to lack of space and staff. Countywide, for all hospitals, the issues are really the same, said Gali. All hospitals are working through staffing issues, many are working through infrastructure and oxygen supply issues, which are complicated and numerous. Gali said hospitals are also dealing with increased absences of staff who are getting sick or are exposed to COVID themselves. Just as transmission increases within the community, healthcare workers get sick too, she said. But the problem extends beyond just healthcare workers. We are still facing critical callouts from staff that aren't eligible for the vaccine right now, and that includes supply chain personnel, power plant, people fixing the oxygen system and other areas, she said.